Amol. Last name is Soin, Soin.
Alrighty. So talk to me a little bit about how you kind of got involved with being on this committee first off.
Sure. Yeah. So I'm on the medical board of Ohio. I currently serve as the vice president of the medical board. And after this initiative got passed, they had asked me to serve as the state medical board representative on this committee. But I'm also a practicing pain management physician.
What do you hope to bring to the committee?
What I want to do is try to protect the public and achieve a decent balance on how we're going to roll this out to make sure it's rolled out safely and appropriately and when clinically indicated for the patients.
How do you hope they go about that?
Well, it's a really good committee. We have a lot of people represented. So we have physicians on the committee, we have farmers on the committee, we have people from the Commerce Department on the committee. So the collective wisdom of everyone together should allow us to have the resources to make sure we roll this out appropriately and fairly.
Gotcha. Do you have, are you hoping for any time frame? I know that they're saying, it could be a couple of years still.
It really is a challenge, and it's hard to nail down a time frame, and I would hate to give anyone expectations of when they can get it. But the most important thing is that we do this properly and take the appropriate steps to make sure it's rolled out so that we have patient access coupled with safety for the public.
Mm-hmm. And when it comes to patient safety and being that patient advocate kind of, what is your message for that?
Well, when you think about it, in Ohio we have a lot of problems with opioids and prescription painkillers and heroin, and as we know, marijuana is also a drug that can have some aspects of it that's also not safe. So I think the big goal is to make sure that we roll this out and maintain the safety at the same time. There are patients in need who could benefit from the therapy. At the same time, we have to be sensitive to people who may divert the drug or use it recreationally.
Do you think this is the right way to go about kind of introducing marijuana to the state compared to maybe like last year when it was on the ballot?
Well, I'm pleased to see that there is no recreational use for the marijuana, and I think the medicinal use for some aspects is debatable, but the fact that we have a committee of very intelligent people working on this together, I think that we could have a mechanism to roll this out where it's safe.
Is one of the areas that you're focusing on is how it's going to transition with physicians of prescribing it and how that's all going to work?
Most definitely, and so there's a couple of prong process with that. The first is, of course, the State Medical Board of Ohio working with physicians and giving them the ability to recommend it, and the second is this advisory committee that's also going to help roll it out.
So if doctors are watching this, saying they don't have to prescribe, it's not going to be something that they would have to do, right?
Correct. At the end of the day, it's up to the physician judgment. And what we want is the patient and the physician to come together and realize what the best avenue is for their clinical indication.
Alrighty. So what do you hope to get out of this first meeting?
Well, this first meeting is great. We had a chance to meet all the other committee members, introduce ourselves, and really it's a learning process for us and for everybody that's watching here today to learn about how this is going to roll out, learn about how we're going to set up the rules and guidelines about it.
Anything else I'm missing? Thank you.
Thank you.
What is the best way, I have this
sweet dreams are made of this. Sweet